Well, as always, thanks so much for spending your valuable time to join us here at the Art of Feminine Negotiation. I think you'll be glad you did. Today, we're going to be talking with Delia Chiaramonte, and we're going to be talking about negotiating a loved one's illness. And we've all had that. And Delia comes with lots of chops in that regard. So, welcome, Delia. It's great to have you here.
Thank you so much for having me.
And for those of you who may not know her, Dr. Delia Chiaramonte is an integrative palliative medicine physician and caregiver coach. She's also the founder of the Integrative Palliative Institute and host of the Integrative Palliative podcast. Tongue twister, made me say that 3 times in a row there.
Yeah.
She's also an adjunct assistant professor at the University of Maryland, and she's been voted top doctor by her physician peers, which speaks volumes. So why don't we jump right in, Delia? And I love if you could tell us a bit about what inspired your recent book. I think it's called Coping Courageously, a heart-centered guide for navigating a loved one's illness without losing yourself, which I love. That really caught my attention.
Yeah, thank you for that question. So the reason I wrote this book is because when I was practicing palliative care, here's what I noticed. There were a group of families who, even though their loved one had a really difficult illness, coped fairly well. And then there were other families whose loved one had the same kind of illness, but they imploded and they fell apart and they couldn't talk to each other and they would fight and their distress was just through the roof. So while both sets of families obviously were suffering because their loved one was ill, one group was suffering way more. And so my question for myself was, what are the families doing who are coping well? And if I can figure that out and I can teach some of those things to the other families, will it help them cope better too? And it turned out that it did. And those are the things that ended up in my book.
Oh, such an important issue. I mean, and it resonated so much with me, having dealt extensively with healthcare systems for my kids. I had a daughter who had open heart surgery as an infant. I have a
Oh,
son
boy.
who more recently has dealt with significant mental health issues. We've just dealt with the hospice for my mom. So
Oh,
for the
boy.
listeners, you can see why I had to have her here today. What were you going to say?
You get it. But I
Oh,
think it just shows that this is a universal experience.
absolutely. Now, what's one of the most surprising things that you discovered while researching or writing your book?
I think one of the most perhaps surprising things that I noticed in gathering the information from the book from my own experience is the impact of toxic positivity.
Ah, explain what that is. We hear that term being bantied around a lot now, and there
Yeah.
certainly is a lot just buckeye, especially in mental health. I saw it with my son. Everybody's like, oh, don't use the language about things being challenging. That's, as if we could just magically flip a switch and be better. So I'd love your perspective on it.
Yeah, so this is what I saw so commonly that families do that they think is helping, but actually is really harming. And it looks like this. So let's say that a patient is in the hospital and the oncologist has come by earlier in the day and said, oh, we're sorry, but the chemo isn't really working. We'll try this new thing, but I'm not positive that it's going to work.
Yeah.
And then as the palliative care doctor, I come in later. And this was a very common experience. I would show up and say, hi, I'm Dr. Chiaramonte from the Palliative Medicine Service, and your doctor asked me to come by. And the patient would say something like, yeah, I'm not sure, what's going to happen because the doctor said the next medicine might not work. And then the family members jump all over them. What? Dad, you can't say that. Don't
Yeah.
you talk that way. Don't you dare talk that way. Everything's going to be fine. Everything's going to be fine. You have to be positive.
Yeah.
And here's the thing, that comes from love. So the family
Yeah.
wasn't trying to do something bad.
Yeah.
They wanted their loved one not to suffer, not to be afraid. And then they thought by, squashing it that somehow that would make that happen.
Yeah.
But that's not what happens. What happens is that patient learns that thought is not welcome here.
Yeah. Yeah.
Right. And so it's not like it banishes it from his
Yeah.
head. He's thinking, uh-oh, my life might be coming short, right? My chemo might not work. I have an advanced cancer. I might be dying sometime much sooner than I want.
Yeah.
He's having that thought. He tried to share it with his family because they wouldn't allow that. Now he's alone with that thought.
Because he can't even talk about it. He can't share it with them. That's it.
right?
And the other thing I imagine with that, as I'm thinking about it, Delia, is that it also stops people from preparing, right? They're like, no, this is going to
Right.
work. So we won't look at hospice. We won't look at other alternatives. We're going to just keep that little tunnel vision of positive chugging along. I totally get that. Yeah.
100%. And so, right, it stops them from preparing the practical things like
Yeah.
figuring out about hospice, maybe even doing an advanced directive, which is really important.
Yeah.
But maybe at least as importantly, it stops them from doing the emotional stuff, like saying, I'm sorry for that thing I did, right?
Absolutely.
Saying the things that I really want to say before you die. If I pretend la 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 that you're not ever
Yeah.
going to die, I don't have the time to say the thing that I really would want to say or to
Yeah.
do a legacy project. I call them
Yeah.
a love project. Like,
Yeah.
let's put everybody's handprints together, or let's
Yeah.
go on a special trip, or, let's have a party to celebrate your life, or all the things that you could do if you would acknowledge what's really
Yeah.
happening.
Yeah. And not only just the time, it's interesting as you, I hadn't thought of it that way until you just said it, but it's like you're not allowing yourself to go there because somehow that would be an admission that this is the end. And then you leave all of those things unsaid. That's a
Right. Yeah.
really powerful message. And take a minute. You'd mentioned about an advanced directive. Explain what that is for some of our listeners who may not know, and why some of those things are important. Because again, I think people get in resistance mode and end
Yep.
up not dealing with some of the stuff that would best serve. So tell us a bit about that.
Absolutely. Thank you for that question. Advanced directives are so tremendously important, and they are not just for people who are sick. I have an advanced directive.
Yeah,
My husband has one. I have two young adult daughters. They each have one.
yeah,
An advanced directive has two parts. It is imagining what you would want if you were to be in a very serious illness
yeah,
situation. So either an end stage illness, or even though a persistent vegetative state, which could happen from a car crash, right? So it
yeah,
could happen to any of us. So
absolutely.
it's saying two parts. One is, who would I want to speak for me to the doctors if I ever couldn't speak for myself? So you write down that person's name. You ask them, will you serve as this person? And then you write down their
Yeah,
name. And then what would I want in terms of aggressiveness of care?
yeah,
If, for example, in a persistent vegetative state, if I were never expected to wake up again. So if that were the case, would I want to be on a ventilator? Would I want to be in the intensive care unit? If my heart were to stop, would I want them to do CPR, even if I'm never going to wake up again? Would
yeah,
I want a feeding tube? So prolonging my life in a nursing home where I'm never going to recognize my people again.
yeah,
And the reason to state those things is that everybody wants something different. Some people feel like no matter what state I'm in, I want every minute on earth that I can have.
yeah,
Great. That's perfectly fine to make that decision.
yeah,
So then you should say that in your advanced directive. Other
yeah,
people, I include myself in this group, if I'm never going to recognize my people again, never going to be able to wake up or feed myself or, connect with my loved ones, I'm ready to go to what's next.
yeah,
So there's no right way or wrong way, but the idea is that you should be recording what would work for you.
yeah,
And then as a backup, picking someone who will know you and know what you want, who can make a decision in case it's not really clear from the form.
yeah,
And so everyone should have one. And here's the mistake people make, I think. They don't usually think it through. And do I have time to tell a quick story?
yeah, sure.
So there's a story that's in the book, which was my patient and is a heartbreaking story. So this woman was in her 80s and she'd had a stroke, and she had one son who was brought in to make decisions about her. And she was unconscious and was never expected to wake up again, but she had not died. So her heart was working, but her brain
Yeah,
was not working.
yeah,
And so he said, oh, mom would never want to live like this. He told us how dynamic she was and what an amazing person she was. And she was like the person in the neighborhood who took care of
yeah,
everyone. And she had told him she would never want to live like this.
yeah,
So we said, okay, great. You're clearly making a loving decision. And we made her DNR, do not resuscitate, and with no feeding tube, because that
yeah,
was his choice. However, he then said, oh, I found her advance directive that she had and like put in her files.
yeah,
Normally, that's a good thing. except in this case, he brought in the advance directive and it said that she would want a feeding tube if she ever couldn't feed herself.
Oh,
And
yeah,
he said, no, 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 she wouldn't want that. But she had checked a box on her advance
yeah,
directive that said there was no flexibility. So there was nobody named to speak for her, and her
yeah,
son had no flexibility. And this meant that instead of being allowed to pass on hospice, she was going to get a surgical feeding tube and be sent to a nursing home
yeah,
to live potentially for a year until she got skin breakdown and died from
yeah.
it.
Oh,
And the son said, no, this is not what she would want. We even went to the hospital lawyers and said, can we listen to the son
yeah,
instead of this advance directive? They said no.
no. Yeah. And people don't update sometimes either as we go. And it's such a touchy
Yeah.
subject. We are not only are we a death phobic society, but we hate even dealing with this. And it's
Right.
ironic because recently I presented all of my kids with medical power of attorney forms and said, look,
You do.
doesn't have to be me. I don't care, but you guys need to be thinking about this, right?
Yep.
And they were all really reluctant, and it's so important. I remember when my dad died, and 30 years ago now, he was very young. It was unexpected, and
Oof.
it's still one of the great regrets I carry because they approach us in the moment. They should have waited, just even given us a little bit of time to process, but they came and asked about donating his eyes, and it was imminent. And we all said no. And I've never admitted this publicly, frankly.
Oh, I understand.
And he would have wanted it, and we knew he would have wanted it, and but we didn't come to that until later. So
Yeah.
totally get that. Now, as I said, I've dealt extensively with the healthcare system, with all of our personal. And one of the things I came to realize is that there's a lot of negotiation involved in dealing with the serious illness of someone in the family. It's one of the reasons I wanted you on to speak to that, Delia. So can you tell us about some of those negotiations and how to best navigate them, whether with doctors in the medical system or adult children dealing with, aging parents, or even with the patient? What are your
Yeah.
takes on that?
All of those things. There is so much negotiation when you are dealing with a serious illness.
Yeah,
We'll take the medical system first.
yeah,
So there's sort of the big picture negotiation, and then there's every tiny little negotiation that happens, for
yes,
example, if someone's in the hospital, right? So maybe the big one is, well, what treatment plan are we going to do?
yeah,
So the doctor might say someone has cancer, okay, so I recommend X chemotherapy. And you might want to say, well, what are the side effects of that? And does every doctor agree with that? Is this an
yeah,
experimental kind of thing, or is this standard of care and everybody gets the same thing? You might say, well, we have a wedding in 3 weeks.
yeah,
So can I wait?
yeah,
Because if I start, I'm going to get sick. So could
yeah,
I wait to start the chemo until after the wedding, for example?
yeah,
And sometimes the answer would be yes, but if the wedding, for example, is in 3 months, the answer might be no. So,
yeah,
but what if it's 4 weeks? So there's negotiation of like, well, how bad would it be if I waited?
yeah,
Because this is really important to me,
yeah,
right? So there's the negotiation around the treatment. But then if you, for example, have a loved one in the hospital, oh my gosh, like everything
yeah.
is a negotiation,
Oh my
right?
gosh, tell me about it. We had 3 months in intensive care of that. It
Oh
felt
my
like every
gosh.
day was hundreds of negotiations. So
Hundreds, like, when will you come in? When will you do the CT scan? Do you have to do the CT scan at
yeah,
9 o'clock at night? She just fell asleep. Is it
yeah,
okay to wait until the morning?
yeah,
When is the medicine coming? Her pain is high. Can you please give her more now? Well, I'd have to ask the doctor. Well, can you please call the doctor then
yeah,
right now because her pain is bad? Her bed is messy. Can somebody clean her up? We don't want to wait till the next shift. Can you please do that now? Or
yeah,
even, wait, what's that blue pill? We didn't have that one yesterday,
yeah,
and nobody told me there was a new pill. And I know there's a lot of medical errors that happen. Stop, please
yeah,
call the doctor and find out what that pill is before my loved one swallows it.
yeah,
So it's really one of the reasons that ideally, if you have someone you love in the hospital, somebody should be there
yeah,
most of the time with them, because they can't always negotiate for themselves. And they
yeah.
might just swallow that blue pill, which
Yeah.
maybe was meant for the room next door.
Yeah. And I want to pause for a minute and really let that sink in for our listeners. And for any of you out there have dealt with this, or hopefully this will stick if you have to deal with it in the future as well. Because boy, did I find that with my daughter. As you say, things happen in the hospital, mistakes. And when you're there as a caregiver, as a loved one, you see things, and I can't tell you how many times, Delia, they would come and say, "Oh, she's failed her, reintubation," and it wasn't accurate, but
Yeah.
somebody had said it and it went around, and then I would have to challenge every time, going, "Sorry, I don't mean to interrupt," and they would do it on rounds. That's actually not true. They had talked about doing it. They never tried to reintubate again. She has not failed, an intubation, and having these, and same with the medication. Here's what her reaction is. Every time you give her L-docticide, here's what her reaction. Well, that's medically impossible. Like, well, I'm telling you it's here and I want to just, and most people don't, we aren't conditioned to challenge those kinds of questions. We assume that they know. So, and I found ego often came into it. So I'd love, doctors, certainly in my experience, I think some were fantastic, most were fantastic, but some certainly did not like being questioned at all. They saw it as a challenge. So
Yep.
any tips on how to deal with those big egos in that situation before we move on to some of the other negotiations?
Yeah, what a great question. I think I'm going to say two things that sound like they're in opposition, but they're both important. So the first thing is try to be respectful because
Yeah,
it will help you get what you want. So
absolutely.
rather than implying, well, you don't know anything about this, doctor, and I know so much because
Yeah,
my daughter is sick,
yeah.
which I understand because I also had a daughter, have two daughters, both have had medical issues.
Uh,
But here's a great line, as I'm sure you know,
yeah,
doctor,
yeah,
blah, blah thing that I know that you don't
yeah,
know.
yeah,
So just say that. Like, I know it hurts, it's
yeah.
annoying, but just
No,
say, like, as I'm
absolutely.
sure you know that that medicine interacts with this other medicine. So probably don't you think it would be better to do just one and not the other?
Yeah,
Allows them to say, oh, yeah, that's a good point, without you saying, you don't know this, but I know this. So you have to listen to
yeah,
me because that gets their hackles up. So that's one side. The other side of the coin is if they're really not giving you what you need, push back, and if they get mad, who cares? I
yeah,
hate to say it that way, but
yeah,
you do have to take care
yeah,
of your loved one.
yeah.
And you can always send, and it's not just doctors, also nurses too. You can always send a fruit basket later when it's all over
Yeah,
to the floor,
yeah,
but you really do need to stick up. Like if they say, well, I'm sure this is the right medicine, you
yeah,
say, no,
yeah,
stop.
yeah,
I don't have time to call the doctor right now. Well, then we'll wait. We'll
yeah.
wait to take the medicine until you call the doctor.
Yeah. And great advice on both fronts. And again, for our listeners, those of you who follow know one of my core models for art feminine negotiation is what I call RFIT. And it's that AREFIT. And the REFIT is all exactly what you said. First, you build rapport, you show up with empathy, you build that trust with them, you trust your intuition, right? You stay flexible, but ultimately that A is for assertiveness. And when you need to, then you revert back to that. So I think that was beautiful, beautiful advice. And what you've probably had lots of experience as well about negotiating with the patient, which can also be challenging depending on the situation. What insights do
Yeah,
you have about that for us?
sure. From a doctor's perspective, you mean?
Or just things that you picked up, as you say, watching different families and reactions, and what's some of the most effective ways to be able to negotiate?
Yeah, absolutely. So let me speak first, negotiating from a doctor to a patient and then family to patient.
Love that.
So from the doctor to the patient, I think the most important thing is to engage in what is important to them.
Yeah.
So there's an official way to do that, which is called motivational interviewing. But even if we don't officially do that process, here's what doesn't work. You need to take that medicine because I'm the doctor and I said so. And if you don't take it, you're going to die.
Yeah.
That doesn't work. It may be true that if you don't take it, you're going to die, but
Yeah.
it's disrespectful, first of all.
Yeah.
It's disrespectful to the person's own autonomy.
Yeah.
And it also doesn't work because as human beings, if someone bosses you, your inclination is to boss back. It's like, well,
Yeah.
fine. And then throw out the prescription on the way out the door. So what
Yeah.
matters, what works much better is to say, what is important to you in this situation? Your blood pressure is completely out of control. And I worry about that. I'm worried about you, but I hear you that you don't want to take these medicines. So help me understand what is important to you in this situation. Well, it's important to me to be as natural as possible. Okay. What else? It's important to me not to spend too much money because I don't have that much money. Okay. It's important to me not to have to spend all day taking medicines. Okay. So suppose we could get a medicine that tends to have low side effects that is just once a day and isn't too expensive. Would that be an okay thing to try?
Yeah.
Right? And they might say, okay, fine, I'll try it. And then giving them as much control as possible. Why don't you try it for 2 weeks? And if you hate it, come back. I won't be mad at you. I won't fuss at you. We'll talk about it and we'll see what other plan we can make.
Yeah. This is
Right?
gorgeous. And just before you go to the next part about the non-doctor piece, I really want to put a pin in that for our listeners because that was beautiful advice that you just got there. It's, show up with you. And this applies not only in the medical system, but I would say even beyond that for all of your negotiations. show up with curiosity. For the love of God, ask questions instead of making it about you. Surrender your ego, find out what their needs are. You will get so much more out of your negotiations in life. And I love that you talked about giving control as well, because, ultimately, the best way to have control in a negotiation is to let go of control, cede
Yes.
control to the other party. So I just want to really
Yes.
put a pin in that. I thought it was beautiful advice. So sorry to interrupt.
No, that was wonderful. That's terrific. It's interesting how the same principles apply pretty much across the board in life and human interaction, isn't it?
But people don't think of I think when people are in the healthcare system, they don't think of these as negotiations. And that's why I was really excited to have you on to have this discussion, because these are at their core negotiations. So, and I know you're going to talk about any insights you had as well about, first the doctor and then also for others negotiating with the patient, maybe of the loved one.
Yeah. So this comes up all the time too. Of course, negotiating, let's say, with an aging parent.
Yeah.
And there's a lot of places that can come up.
Yeah.
Things like driving. Is it safe to drive anymore? Is it safe to use the stove? Is it safe to live at home? Is there
Yeah.
another place, a facility that maybe they need to live for to be safe? And that can be a really challenging negotiation. That's one
Yeah.
big bucket. And then I think the other bucket where people feel afraid is talking about end of life decisions. So talking about filling out an advance directive or
Yeah.
talking about, do you want to be intubated because gosh, your COPD is so severe
Yeah.
now and the doctors said if you get intubated, you might get stuck on the ventilator.
Yeah.
So, what should we do? What do we want to put on the forms and in the hospital? And so sometimes people are afraid to start because they don't know how to start. They just don't know how to bring up this
Yeah.
conversation. And I would encourage people just to do it messy. As
Yeah.
in,
I love it.
if you don't know how to start, here's how you start. I don't know how to have this conversation, but I think it's really important that we have it. So I'm just going to try my best. Is that okay?
Yeah.
And most of the time, your loved one will be like, yeah, sure, it's okay. So
Yeah.
the two things that are important in that part of it are just be open with the fact that you don't know what to do, totally
Yeah.
fine, and ask permission. Is it
Yeah.
okay if we have this conversation?
Oh, such
And
great advice. Such great advice. And I would say as well, people, I think as humans, we tend to, if there's messiness, our immediate
yeah,
reaction
we
is to
run
push
away.
away. And it really, the gold nuggets, if you will, lean into the messiness, right?
Yeah.
Again, whether in this situation or in any negotiation, use the emotion that you see as a way to lean in to get those better outcomes. So,
Yes.
uh,
And self-reflecting is important too. This is sort of a funny thing to talk about, but I think it's real. Sometimes without knowing it, we we have this like magical feeling that if we talk about death, people will die.
yeah,
But
it's
that
true.
is not how death works.
It's true. I'm calling it to me.
Right? Like we can't talk about that because what if it happens? It's not
Yeah,
how it works. For real, it's not how it works. It's okay to talk
yeah,
about it and then not talk about it. People
yeah.
also think if we bring it up, we will all cry for the next 500 days. You won't. You might
Yeah,
cry for a little bit and then
yeah,
it will pass and then you'll go to lunch or you'll turn
yeah,
on the TV. It's okay to talk about these things even though it's scary.
yeah.
So,
Yeah.
so
And
those are the first.
not only okay, I'd say it's healthy because it's getting over the fear, right? Like
Yeah.
most things in life, it's those things we fear. Our fear of rejection, our fear of failure, our fear of hearing no is what holds us back from living bigger, fuller lives. And it's no exception when we're dealing with our loved ones in difficult situations. It's that fear of having the difficult conversation that stops us from doing what we need. And I guess tied to that, I often say that negotiating our mindset is our first and most important negotiation. So what role would you say that plays in the situations that you've seen?
Oh, 100% everything. It's huge. It is the thing that stops people. The words themselves are really not that complicated. It is mostly fear
Yeah.
and fear of addressing the fear.
Yeah.
Like the fear of the fear is so bad that people just can't cope with it. And
Yeah.
there's an image that I keep in my mind, which I share with patients sometimes, which is this. So if you are trying to keep out the fear, like, we can't even think about the fact that he has cancer. We're not going to talk about it. This is where the toxic positivity comes in. It's all going to be fine. We're not going to talk
Yeah.
about it. So this is what I imagine. The fear is outside the door and is banging on the door. And you are up against the door with your shoulder, like using all of your power to keep it out there. But while you're doing that, you can't bake cookies. You
Yeah.
can't have a meal. You can't go for a walk. You can't watch a movie. You can't color with your loved one. You can't do any of those things because all your emotional energy is up against the door trying to keep the fear out.
Mm.
Whereas if you let him in, and he's a jerk and he's smelly a little bit, but he comes in and he sits on the couch and you're like, yeah, he's there. I don't love it that he's there, but there he is.
Yeah.
He's just over there. And then you can go bake cookies and you can go have a meal and you can
Yeah.
go for a walk together because he can be there and you can still live your life.
Oh, that's a great metaphor. Oh my gosh, I love that. That's beautiful. I know Christian Michelson often talks about that all of our fears are fear of feelings, which struck me as you were saying that just let yourself feel the feelings, right?
Yeah.
Like it just deal with it. I think that's beautiful. And just circling back, we touched on it before about the whole doctor dynamic, and you gave us some great concrete tips. I think showing up with confidence is key in any negotiation, and especially these negotiations, because most
Mhm.
people aren't confident when dealing with medical professionals. So
Yeah.
do you have any other tips for that? For that to show up with confidence about advocating for your own healthcare or the healthcare of a loved one?
Yeah, I think the biggest thing there is persistence.
Yeah.
So you don't want to show up too cocky
Yeah.
because doctors kind of get their hackles up and sometimes
Yeah.
they're less receptive, but you have to keep pushing because they might say, yeah, okay, well, I'll talk to the doctor about that. We'll see for next time. No, I need you to do it right now. Well, I don't have time to do it right now. Well, can I have the doctor's phone number then? I could call them right
Yeah.
now. No, I can't give that to you. Then who else could call the doctor right now? So you might have to say it
Yeah.
5, 6, 7 times, but once it's clear you're not going to back down,
Yeah.
eventually they'll roll their eyes and they'll go do what you ask them to do.
That's
And
great.
and here's another example of persistence that I think is really important. This one is really important. If you have a loved one who's in the hospital and they are older, sometimes when they go into the hospital, they get delirium,
Yeah.
meaning they're confused,
Yes.
right? And they may not know their name or the date or
Yeah.
whatever. But delirium, which is temporary, is not the same as dementia,
Yeah.
which is permanent.
Yeah.
But it looks exactly the same to everybody who
Yeah.
walks into your loved one's room,
We dealt with that. Yep.
right? So if they walk in, nurse walks in, or doctor walks in, or physical therapy, whatever, walks in, sees an older person in the bed, totally confused, they will assume this is a
Yes.
non-functional person with a long-term dementia.
Yes.
And if last week they were doing the crossword puzzle, you have to say that to every single person who comes in the room
Over and over
over
again.
and over because in their mind, they're just like that person has dementia,
Yeah.
but they don't. But
Yeah.
the only way they're going to know that is if you keep saying with specifics. So not just like,
Yeah.
oh, this isn't him. No one knows what
Yeah.
that means. If you
Yeah.
say last week he did the New York Times crossword puzzle and he finished it.
Yeah.
Okay. That is the person that he's been working as an
Yeah.
attorney until 2 weeks ago. You have to keep saying that over and over.
Yeah.
And then people, the medical team will go, oh, well, then this is unusual. Yes, this
Yeah.
is unusual, but you might have to say that 20 times before they really get that.
Oh my gosh, Delia, that is such great advice. We just lived that with my
Did you?
mom.
Oh,
And
gosh.
they treat them differently. If they
Yes, they
assume
do.
this is advanced dementia, the
Yes,
level
they
of
do.
care was dramatically, and we had to keep saying, this is not her baseline. Here's where she was at to every caregiver who came
Yep.
in that room. So that is great advice for our listeners out there. Make sure you remember that because that is a difference. And I also want to point out for our listeners, notice Delia's tone when she was talking about that persistence with the doctors. She wasn't aggressive. She wasn't grading. She wasn't demanding. She was assertive about what she wanted, but with the most respectful voice makes all the difference in the world. And I'd suggest rewind, re-listen to this episode and pay attention to that tone of it. Well, who can I talk to? Who does have the authority? Again, it's all about that presentation in terms of how your message is received. Because ultimately, it's not about a power play. It's about getting the outcome you want. So that was such great advice. And most people end up stressed in that situation. So do you have any tools for us, Delia, about how to lower stress in handling these situations?
Yeah. First of all, recognizing that you're just exactly what you said, that what the energy you bring impacts how people will listen to you, I
Yeah.
think is the most important thing to start with. Because
Yeah.
sometimes people feel this stress, but they turn it into aggressiveness.
Yeah.
And then they get labeled as a difficult family, and then they're less likely to get what they
Yeah.
want. So I think the first thing is to not think that your agitation and anger is something that you're going to use for your communication. Rather, it's something
Yeah.
you want to tone down if you can, so you can get what you want.
Yeah.
So once you realize that, like, okay, I'm getting agitated and I need to do a thing.
Yeah.
One of the most effective ways to calm down that feeling where like you're shaking, you're so mad that you're shaking, is actually to do what I call emergency exercise, meaning 20 jumping jacks or walk up and down the
Huh.
stairs 3 times. And
Yeah.
here's why. So our stress response is made in our body. The reason we have it is to keep us safe. Right. So once
Yeah.
upon a time, we lived out on the tundra. And if we got really agitated like that, it's because some really big thing with big teeth was coming towards us.
Yeah.
And so our body sets itself up to run or fight,
Yeah.
right? To run or fight. And so it's very hard unless you're an uber experienced meditator to just meditate that feeling away.
Yeah.
It's physiologic, right? Like
Yeah.
all of these chemicals have flooded into your body, preparing you to fight.
Yeah.
But fighting is not going to get you what you want. So what else can you do is you can run, basically. So you can do some emergency exercise,
I
run
love
in
the term.
place, like being in your hospital, running in place, go up and down the stairs, run around the block, something that discharges some of that physiologic expectation of exercise. Then, and only then, generally, can you do things like slowing down your breathing,
Yeah.
breathing in a way. This is the part of breathing that stimulates your relaxation response is when
Yeah.
the exhale is longer than the inhale.
Mm.
Exhale is longer than the inhale. So if you can even count, like if you breathe
Yeah.
in and maybe you count to 4 when you breathe in, when you breathe out, count to 6 or 7.
That's so great. And I've never heard that tip before. In all the years that I've been practicing with all personal development and all the, I love that because everybody just immediately talks about breathing, but that really
You,
struck a chord with me that
yeah,
that breathing is not going to be effective until you discharge all of
exactly.
that energy. That's so smart, so
Yep.
simple and so smart.
And
So
by the way, if you have teenagers, I use this with my teenagers who get really agitated about things and want to talk about it. I would have my kids walk up and down the stairs 5 or 6 times, then come back and talk about it. It goes much better.
that's great, great advice. My God, you're getting parenting advice here as well. This is
Exactly.
awesome. I love it. Now
Bonus.
we talked about hospice and palliative care a couple of times, and I read somewhere that you talk about some of the most common myths about palliative care. I'd love if you could share that with us.
Yeah, sure. So the biggest myth about palliative care is that it's the same as hospice, which it is not. So
Yeah,
palliative care is not end of life care
yeah,
exclusively. Palliative care is whole family care for people with serious illness focused on relieving suffering. That's all it is.
okay,
Focus on relieving suffering, not prolonging life, but relieving
yeah,
suffering. But it's appropriate at any time in a serious illness. So if you have a stage 2 or 3 cancer and they're hoping to cure you, it is appropriate to get palliative care then.
yeah,
We're all for cure. If you can get
yeah,
cured, fabulous. That's
yeah,
great. But, do you have symptoms from chemo? Probably.
yeah,
Are you having stress or anxiety or, depression, even maybe because of the stress of this experience? Yeah, maybe. Do you have medical decisions that you have to make? Probably. All of those things are in the wheelhouse of palliative care. So anybody with a serious illness, it's appropriate to have palliative care because our focus is on relieving suffering.
yeah.
So I always find it bizarre. Why would you not want us? Everybody should want palliative care. You're focusing on relieving
Yeah.
suffering, right? A lot of doctors, like oncologists, God bless oncologists, but they're
Yeah,
giving you stuff that makes you feel terrible,
yeah.
right? Our whole focus is relieving physical suffering, emotional suffering, and spiritual suffering alongside whatever other doctors you have.
Yeah. Well, and thank you. I didn't know that distinction, frankly. So, and that's an important distinction to draw. And do you have any non-negotiable habits that you're committed to daily that you can share with our audience here?
Me, myself, for my own well-being.
Yeah, yeah, either the ones that you practice or that you would suggest for other people, because we all have practices that we know we should, don't always do them. So I won't put you on the spot.
No,
Any
that's fine.
non-negotiable habits you would suggest?
I'm all for it. I think a lot of my habits are around well-being despite difficult situations. So there's a thing that I do every single day that I think I've taught to every patient that I've ever had, which I'll share with you guys, which is this phrase: I really don't like blank, but at least blank.
Yeah.
And here's what that does. That allows space for the yucky part
Yeah.
and it practices gratitude. So I have a gratitude ritual myself that I do
Yeah.
every day, but I find this even more important than that. So, oh, I don't like that I have to go to this meeting so early, but at least I have a running car.
Okay.
Or I don't like that I didn't get that position that I wanted, but at least I have this wonderful dog who cuddles with me, right? They don't even
Oh,
have to be related. So I
yeah, I
don't like
love
that I have to go to
that.
this thing, but at least I got a good parking place.
Yes, that's so good.
I do it all day long. So anytime you complain about something where you're like, oh, blank, that's the I don't like, just
Yeah,
say, but at least, well, it could be anything. It could be, but at least I have air conditioning, but at least my toilets work. They don't have to be related.
yeah,
Point is, it acknowledges the challenging parts of life and then practices just turning your head to the side a little bit to find some positive. One of the chapters of my book is called Flowers in the Poop. Basically,
yeah.
this is that. So you find flowers. There's a lot of poop in life, but there's also flowers.
Oh, my husband has a sanitation business, so that struck a
Oh,
chord with me probably more than most people. That's hilarious. And I must say, Delia, you have this great way of like that is such a refreshing twist on gratitude. We hear so much about gratitude, but again, I haven't heard it paired in exactly that way before, where you take the thing that is frustrating you and apply the gratitude practice in direct reference to it. I think that's
yeah.
a really great practice. Again, so simple. And yet I haven't heard that before in all these years. I think that's great. So, well, I can't believe how quick our time has gone. And my gosh, you've given some fabulous nuggets for us here. I normally like to end by asking, what's one of the greatest mindset shifts that you've ever had in your life? It can be on this issue, but it can be on absolutely anything, just an aha thing that changed and bettered how you show up in the world.
It is related, I think. I think the biggest mindset shift that I learned that has made me a happier person is that even when things are hard, you can acknowledge the hard and then you also can find ways to feel good.
Yeah.
And to make basically, I think the idea is make space for two things. Make space for whatever's hard and make space for things that are good.
Yeah.
And that concept, I think, is really appropriate in palliative care, which is like,
Yeah.
yes, your loved one has cancer, and that we hate that.
Yeah.
And gosh, we've gotten closer since this experience, and we've had all these wonderful conversations that we never would have had before,
Yeah.
right? Or whatever else. So just people think you have to choose, like I'm either fighting or giving up, or like there's one or the other, but it's almost always both. Just hold space for multiple ways of being at the same time, and I feel like it makes life better.
Oh, what a game changer. Like truly, I think that is a game changer. And boy, I probably try not to tear up here. That struck such a chord with me because with my mom, as she started at the end, she just didn't know what decade she was in. And she would think she was seeing dogs outside the fifth floor of the hospital window, right? And at first you resist it. And then when I surrendered to just being with her and being grateful for those moments,
Yeah,
we had some of the best laughs I've had in years,
yeah.
frankly, just years. It was a beautiful experience. So I totally second that. That was beautiful advice.
What a
So
great
where
example. I would love to know what kind of dog she saw. That's what I would say. Oh, what kind
yes,
of
that's
dogs are they? Tell me about them. What colors are they?
yeah, apparently there was a pack of them out there. It was quite
Awesome.
yes. And she'd be seeing children playing and and it was just funny that I thought because she she kept seeing her relatives that she hadn't seen in like decades, many of whom had passed decades earlier. And I used to, at first, I was able to distract her, going, "Oh no, Mama, they just left." Because she'd be like, "Where's so and so? And where's Minnie? And where's Whitty? And where's John?" And all of her brothers and sisters. She was the 13th of 13 kids. But the one time I said, "Oh, you just missed them," and she looked at me, and I mean, I can laugh about it now, but at the time, she goes, and pardon my language, she's like, "What are you I'm even looking at them right now. They're standing here." I was like, "Oh my God." And at least we were both able to laugh about it. So
I love it.
love that. This has been an absolute treat for me. So thank you so much, Delia, for sharing your insights with us here today.
Thank you so much for having me. I had a great time.
Yes. Now, where can people learn more about you as well? We'll make sure to put the link to your book in our show notes and anywhere else. Where do you want people to reach out for you?
Yeah, thank you so much. So I do have support programs for people who are going through this, and they can find me at caregivingishard.com.
Mm. Oh, I love that. That's beautiful. And for our listeners, again, if you didn't get a chance to write that down, caregivingishard.com, and we'll make sure to put that in the show notes, as well as Delia's beautiful book, which will be a great resource for anybody out there, either now because you're dealing with it or in a preparatory way. I would suggest even go get the book
Yeah.
and be prepared so you're not caught off guard. And I am sure you've all got great value from this episode. I know I did. I've heard some really interesting twists on concepts that we often take for granted that I'm certainly looking forward to implementing in my life. Make sure to subscribe if you haven't done that yet. And also make sure to share this episode with anyone that you think can get some benefit from this message, which is frankly all of us, because we all are going to deal with this at some point in our lives many, many times. And before we sign off today, just want to share some ways that we can work together. If you're looking to up-level your negotiation skills, recognizing that all of life is a negotiation, I've got everything from online to group to my signature VIP and mastermind experiences. It'll help you better leverage your innate natural powers to get more of what you want and deserve in life. And if that sounds interesting, check that out at artoffemininenegotiation.com. And if you haven't already get my book, make sure to grab that, The Art of Feminine Negotiation, How to Get What You Want from the Boardroom to the Bedroom. And that is a wrap for this episode. So until next time, go forth and negotiate your best life on your terms so you can stop missing out and start getting more of what you want and deserve from the boardroom to the bedroom. Until next time, take care.